In this video, we're really going to be focusing on shoulder pain, specifically shoulder impingement caused by improper contraction of the upper fiber trap and lower fiber trap muscles and the serratus anterior muscle. So basically, when the shoulder blade is improperly positioned in the sense it's not upwardly rotating properly, like so that I'm demonstrating with my hand, the rotator cuff, specifically underneath that acromion part of the shoulder blade, gets jammed and squished under the shoulder blade. So we're going to start by warming up our shoulder blade muscles with huge circular motions. So bring your shoulders as far forward as you can, up to your ears as much as you can, and squeezing them together as if you're trying to hold a sheet of paper between them. So you're going to keep exaggerating this motion as much as you can. I'm showing you a couple different angles here if that helps to demonstrate and get that picture in your head a little bit better. And now circle the other way. Really feel the stretch, get those muscles going, get the blood pumping, because we're going to be doing some work today to reactivate and help these muscles move better so that that shoulder impingement we developed can leave over time. Sometimes rest is not only the answer, right? Because if the problem was caused by improper muscle contraction, then that's what you want to focus on. Treat the cause, not the symptoms. Now, your thumbs are going to be pointing back and you're going to squeeze your shoulder blades together. So for women, you're going to imagine the bottom corners of the shoulder blades are going to squeeze as if you're trying to squeeze to the bra line. You do not want your shoulders to raise towards your ears in this case. Okay, you want to keep your shoulders pressing down. So like I'm showing you here, you do not want that. You want your shoulders to be going down. So for men, you want to imagine the bottom corners of your shoulder blades are trying to reach for the midpoint in your back. Trying to lift, really open up that chest, squeeze everything, and now try and touch your elbows together in the back. And so stretch your elbows out and try and touch them together in the back. So you're just squeezing again. The purpose of this is just to warm up the musculature, get the ribs in the back mobilizing a little bit as well, because oftentimes a rib cage inability to move also causes the shoulder blade to move improperly. Two birds, one stone here. And now just stretch everything in the back. So really trying to curve forward. I'll show you from the side what this looks like. So really trying to get an arch in the back, stretch things out. And let's get started. This is an easy exercise, or I should say a simple, maybe not easy, a simple exercise to help activate that serratus anterior. So you go down on all fours like I'm demonstrating, and you want to keep your elbows pinned straight. So do not bend your elbows here. You're defeating the purpose. You want to imagine and picture your shoulder blades are squeezing together as you drop your chest close towards the floor, and then you push and glide your shoulder blades away from each other as you try and lift your chest away from the floor. So this is what's known as a scapular push up, where you're just mobilizing and moving your shoulder blades, gliding along your rib cage in the back, and then gliding forward along your rib cage to work on that serratus anterior muscle. So the serratus anterior muscle would be doing that motion that pushes your chest away from the floor. So this is great if you have a winged scapula, and again, if you lack that upward rotation ability of that shoulder blade. For those who don't know, the shoulder blade should rotate 60 degrees to help with that proper abduction, so that abduction movement, so almost like that snow angel movement of your arm over your head, and even the arm moving forward as well. And we want to go nice and slow, controlled. It's about quality here, not quantity. You want to really feel these muscles contract, so really exaggerate every single motion. And again, I'm not excessively arching my upper back here because, again, I'm focused on only shoulder blade movement. I'm not trying to mobilize my spine here. So my spine stays nice and straight. My head is in line with my mid-back, which is in line with my tailbone. And if you need to, it doesn't hurt to record yourself so that you can see exactly what you are doing and what your body is doing, because sometimes what we feel we're doing and what we're actually doing are completely different things. So I highly recommend you record yourself just to take a look to see if you look like me when you're doing this. Shake everything out. We're going to move to the next activating exercise. So this is a little bit of a step up here. You're going to go into a lunge position, grab a foam roller around your house, hopefully you have one, and you're going to start out by placing your wrists along the foam roller. So you don't want to just go up. When you initiate this and you're pushing that foam roller right into the wall and slowly gliding up your arms along the foam roller, you're imagining that shoulder blade on the side moving upward beautifully, and you're pushing and jamming that foam roller into the wall as you're gliding downwards. I'll show you another angle in just a bit. The other key point is you want to make sure your wrists stay in line with your elbows, like so. Okay, so again, push away with that arm or with that shoulder blade, so exactly that motion that we were just practicing on the floor. We were pushing our shoulder blades away from each other and keeping those elbows in line with the wrists. So glide, really jam and press that foam roller into the wall. Try to keep the elbows and wrists aligned. And press away. So this one's a difficult one, so you may not be able to just smash out 10 here on your first try, and that's fine. That is very normal. Even though this exercise looks very easy and very simple, if you're doing it correctly, oftentimes 4 or 5 is exhausting, and because quality of the movement starts to be affected, usually when you're initially doing this, you stop about 4 or 5. And that's the best part about doing these exercises on your own, is you can pause the video when you need to, or replay a part of a video if you need to, and even email me or ask me questions if you are uncertain about exercises. And really push away, jamming those arms right into the foam roller. And moving back down. Beautiful. Take a breath in, shake your arms out a little bit, and move on to the next exercise. This may be something you need to skip over. If you have a lot of mobility with your shoulders, you don't necessarily have to do this part, but if you know you are really tight, and if you go up against a wall, okay, so your feet are in front of you, your back is against the wall, if you cannot touch the backs of your hands to the wall, you have tight lats typically. So this exercise would be great for you to do. So essentially I'm lying on a foam roller on the side of my body, and I'm moving my arm in different directions to release that latissimus dorsi muscle on the side. So latissimus dorsi, the lats, are that big V-shaped muscle that attach to our lower back, will glide up, attach to our lower ribs, the bottom corner of our shoulder blade, and will attach to the inner part of the upper arm and humerus. So I'm finding and rolling around on different places close to the shoulder blade attachment. I'm just moving my arm in different rotations, reaching up over my head. Kind of do whatever works for you here. There's some positions that will feel more intense than others. So again, it's important to do what's best for you. And as you become better and better, more flexible, more mobile, this will be effective. You may be thinking, well, I could just stretch the lat, Nichelle. Why are we foam rolling it? Well, recent studies have just shown that stretching just focuses primarily on the tendon, stretching the tendon of the muscle, while foam rolling helps to release the actual muscle belly of the muscle itself. Now, last thing you're going to do is you're going to grab an elastic therapy band, and we're going to work on trying to increase the blood flow to the shoulders and the musculature of the arms. So important note here is you don't want to bring your shoulders towards your chest. Press your shoulders down, squeeze your shoulder blades together when you're doing this movement. Again, we're focusing on shoulder blade movement. So the movement of my arms are actually being controlled by the movement of the shoulder blades. So I'm controlling the movement, letting it pull me in for 5 seconds, and I'm not letting the contraction go, and I'm squeezing my shoulder blades back, trying to hold a sheet of paper between them. as I hold my arms for 5 seconds. So essentially I'm doing a series of lessening the contraction for 5 seconds, not letting off the full tension, squeezing for 5 seconds, and then holding for 5. I'm just going to show you a couple different angles. So squeeze, 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 squeeze. Maintain the contraction, and slowly lower. Again, not allowing for the full release of the elastic contraction here. The entire time, remember, shoulder blades are being pulled down. Imagine the shoulder blades moving along your rib cage here. Keep breathing. Our aim is to do about 8 repetitions here. 8 seems to be the magic number. And relax. You should feel blood just rushing into your arms here, which will be great to help bring blood flow to the tendons that you have impinged in your shoulder. Congratulations on completing this video, guys. If you actually have a shoulder impingement, it would be very beneficial to you, especially if it's new, to do this every day. Now remember, when you're doing this video, you should have no pain or discomfort while you're completing these exercises, because imagine a cut on your arm. If you have a cut in your arm, you don't want to irritate the cut, move the cut around, stretch the cut. You want it to heal properly, but that doesn't mean that we don't do strengthening exercise in the meantime in a painful range of motion that allows to set the body up and rehab it properly, so that as the body is healing the tendon, we don't become weak in the meantime, which will prolong recovery and actually promote secondary complications further down the line and potentially even lead to future injuries in the future. Thanks a lot for your support, guys. Don't forget to subscribe. If you have any requests of videos you want me to release in the future, leave that in the comments below.